How is an endoscope used in ERCP4 pancreatic diagnosis? Imagine a tiny, flexible tube equipped with a camera that can navigate your digestive system to help doctors see inside. That's exactly what an endoscope is in the context of an ERCP procedure. ERCP, which stands for endoscopic retrograde cholangiopancreatography, is a specialized test that combines endoscopy with X-ray imaging to examine the pancreatic and bile ducts. It's a key tool in diagnosing pancreatic conditions, including pancreatic cancer. During the procedure, the endoscope is gently inserted through the mouth and guided down the throat while the patient is sedated. It travels through the esophagus and stomach into the small intestine, specifically reaching the duodenum, where the pancreatic and bile ducts naturally drain. This positioning allows the doctor to get a close-up view of the ductal system and surrounding tissues. Once in place, the doctor inserts a smaller tube through a channel in the endoscope. This smaller tube is used to inject a special dye, called contrast material, into the pancreatic and bile ducts. Because this dye is radiopaque, it shows up clearly on X-ray images. As the dye flows through the ducts, real-time X-ray images are captured, creating a detailed map of the ductal structures. This helps identify any blockages, narrowing, or abnormal growths that could indicate pancreatic cancer or other issues. In the context of pancreatic cancer diagnosis, ERCP plays a crucial role. It allows doctors to see if a tumor or other obstruction is blocking the pancreatic or bile ducts. The endoscope also enables tissue sampling through a technique called brush biopsy. A tiny brush is inserted through the endoscope to gently collect cells from the duct lining. These cells are then examined under a microscope to determine if cancer is present, providing a definitive diagnosis. Beyond diagnosis, ERCP can also be therapeutic. If a blockage is causing jaundice, the doctor can place a small tube called a stent into the duct to restore normal bile flow. This helps relieving symptoms and improves quality of life without the need for more invasive surgery. One of the biggest advantages of using an endoscope in ERCP is that it's less invasive than traditional surgery. Because the procedure is performed through natural body openings, recovery time is usually shorter, and many patients can go home the same day. The combination of direct visualization and X-ray imaging offers a comprehensive view of the pancreatic and biliary system, helping doctors make accurate diagnoses and plan appropriate treatments. It's important to remember that ERCP is often part of a broader diagnostic process. Doctors may first recommend less invasive tests like magnetic resonance cholangiopancreatography or ultrasound to gather initial information. ERCP is typically reserved for cases where intervention is needed or when other tests don't provide enough detail. Always consult healthcare professionals to determine the best approach for each individual's situation. Using an endoscope in ERCP has truly advanced how we diagnose and manage pancreatic diseases, offering a minimally invasive way to see inside and even treat problems at the same time.